Since you guys are involved in treating these patients with combined concurrent chemo-RT, do you have a protocol in place that who is going to order the post-CRT imaging? Is it going to be medical oncology or radiation oncology? Is there a protocol? How do we work it out?
I work with multiple different medical oncology groups at this point. So, and the two main groups that I work with, the medical oncologist is the one that orders it, but to ensure that is happening, my nurse practitioner sees the patient 2 weeks post-treatment and just checks in with them, making sure they're recovering appropriately. But also, that's part of her checklist, is to ensure that things are moving, that they're scheduled for their scan, and that they're following up for their potential immunotherapy.
Awesome. So this is really important in the community practice because we may all go to different hospitals, different EMR system. So having somebody taking ownership, following up the patient so that the guidelines are followed, it's a very good way to go. And that's where the multi-D conferences and communication is very important. So communication. That's the most important thing over here. And we work very closely with our radiation oncologist. So when we start the radiation and finish the radiation, I generally do it within 3 to 4 weeks after completing the radiation, contrary to what you are generally trained to do, that you wait for 4 to 6 weeks, beyond 6 weeks for other treatments. You want to get the chemo and radiation out of the system. And what we do is as the patient is finishing the radiation at that day, the chemotherapy, I ordered the CAT scan and discuss with the radiation oncologist that this is the day we are getting the scan. So we know that bridge will be crossed. About
3 to 4 weeks after. And what I explain to the patient is, when I see them on my weekly treatment visits, I'm talking about what's coming up as well as assessing their symptoms. And what I tell them is this scan is not necessarily to assess your response. It's to make sure there's no new cancer there. Now we're just trying to rule out progression of disease. So I tell the patient, it's going to be about 3 weeks or so after you're done with radiation. And we're just trying to make sure that nothing new has developed in that time frame. That way they're not looking for a dramatic response. They may have one, hopefully they do, but I'm just trying to moderate their expectations and also let them know that this is going to be scheduled pretty quickly after we're done with treatment.
The consolidation administration of immunotherapy is recommended to be within 6 weeks after the end of concurrent chemoradiation, according to ESMO guidelines.